Welcome to Nclex Made Easy 91. In today's session, we're diving into Nclex case study, stroke patient evaluation, FAST, a high-yield, must-know topic for every nursing student. We'll break down critical FAST assessment findings, priority interventions, rationale-based decisions, and test-taking strategies to help you master emergency stroke evaluation and boost your Nclex confidence. Stay focused, take notes, and let's make this super easy, the Nclex way. Patient background. A 68-year-old male arrives with sudden onset right-sided weakness, facial drooping, and slurred speech. Family reports symptoms began 35 minutes ago. BP, 188/102, HR, 94, RR, 20, O2 SAT, 95%. 1. The nurse assesses facial symmetry. The patient's right side droops when asked to smile. What does this finding indicate? A. Normal aging change. B. Fast positive facial droop. C. Hypoglycemia. D. Dehydration. Correct answer, B. Fast positive facial droop. Rationale: sudden one-sided facial drooping is a hallmark fast stroke sign. Strategy: recognize early fast signs for immediate stroke activation. 2. The patient's speech is slurred. What fast component does this correlate with? A. F. Facial droop. B. Arm drift. C. S. Speech difficulty. D. T. Time last meal. Correct answer, C. S. Speech difficulty. Rationale: slurring or inability to speak clearly indicates S in fast assessment. Strategy: match symptoms with fast components for rapid identification. 3. The nurse asks the patient to raise both arms. The right arm drifts downward. Interpretation: A. Normal weakness. B. Arm weakness. C. Pain response. D. Anxiety. Correct answer, B. Arm weakness. Rationale: arm drift is a key fast indicator of stroke. Strategy: evaluate motor deficits to confirm stroke suspicion. 4. What is the nurse's priority after confirming positive fast findings? A. Obtain food tray. B. Notify the stroke team immediately. C. Request family to step out. D. Initiate discharge planning. Correct answer, B. Notify the stroke team immediately. Rationale: stroke is a medical emergency. Early team activation improves outcomes. Strategy: always escalate rapidly with positive fast findings. 5. What is the most important question to ask the family? A. Has he eaten? B. When did symptoms start? C. Does he smoke? D. Does he exercise? Correct answer, B. When did symptoms start? Rationale: eligibility for thrombolytic therapy depends on last known well time. Strategy: time equals brain. Always establish symptom onset first. 6. Blood glucose is 70 mg per deciliter. Why is this important? A. Confirms diabetes. B. Rules out hypoglycemia mimicking stroke. C. Determines diet order. D. Predicts long-term recovery. Correct answer, B. Rules out hypoglycemia mimicking stroke. Rationale: hypoglycemia can present like stroke, verifying rules out false fast. Strategy: always check glucose in suspected stroke. 7. CT scan without contrast is ordered. Priority action? A. Delay test until family consents. B. Send patient immediately. C. Give oral contrast. D. Prepare for MRI. Correct answer, B. Send patient immediately. Rationale: non-contrast CT rapidly differentiates ischemic versus hemorrhagic stroke. Strategy: CT must occur ASAP in stroke pathways. 8. The patient is NPO. Why? A. Prevent aspiration. B. Prevent overeating. C. Reduce blood pressure. D. Reduce edema. Correct answer, A. Prevent aspiration. Rationale: dysphagia risk is high. NPO prevents aspiration pneumonia. Strategy: never give food or fluids before swallowing evaluation. 9. The nurse observes unequal pupils. What does this indicate? A. Normal variant. B. Increased intracranial pressure. C. Dehydration. D. Fatigue. Correct answer, B. Increased intracranial pressure. Rationale: pupil changes may indicate worsening neurologic status. Strategy: monitor neurosigns frequently in stroke. 10. BP is 188/102. What is the priority? A. Administer antihypertensives immediately. B. Avoid lowering BP unless ordered. C. Lower BP aggressively. D. Ignore BP. Correct answer, B. Avoid lowering BP unless ordered. Rationale: elevated BP maintains cerebral perfusion in acute stroke. Strategy: recognize permissive hypertension in ischemic stroke. 11. The patient is a candidate for TPA. Which condition contraindicates administration? A. BP 160/90. B. Glucose 110. C. Active GI bleeding. D. Age greater than 65. Correct answer, C. Active GI bleeding. Rationale: TPA increases bleeding risk, contraindicated in active hemorrhage. Strategy: no TPA exclusion criteria. 12. Before giving TPA, the nurse must A. Insert a nasogastric tube. B. Insert all 4 lines needed. C. Start oral medications. D. Perform deep suctioning. Correct answer, B. Insert all 4 lines needed. Rationale: procedures after TPA can increase bleeding. Strategy: complete all invasive tasks before thrombolytics. 13. A sudden severe headache occurs. Action: A. Give analgesic. B. Notify provider immediately. C. Offer repositioning. D. Encourage relaxation. Correct answer, B. Notify provider immediately. Rationale: worst headache may indicate hemorrhagic transformation. Strategy: treat sudden neuro changes as emergencies. 14. Purpose of fast education for family? A. Prepare them emotionally. B. Enable early recognition of stroke. C. Teach medication administration. D. Prevent diabetes. Correct answer, B. Enable early recognition of stroke. Rationale: FAST allows quick identification and quicker response. Strategy: always incorporate FAST in stroke teaching. 15. Why must time be documented precisely? A. For research. B. For billing. C. Determines eligibility for TPA/mechanical thrombectomy. D. Insurance requirement. Correct answer, C. Rationale: treatment windows strictly depend on symptom onset. Strategy: accurate documentation impacts life-saving care. 16. The patient suddenly becomes confused and cannot follow simple commands. Priority action? A. Reorient the patient. B. Continue monitoring. C. Perform a rapid neuroassessment. D. Offer water. Correct answer, C. Perform a rapid neuroassessment. Rationale: new confusion suggests worsening cerebral perfusion or extension of stroke. Strategy: any neurological change requires immediate assessment. 17. Which finding indicates worsening stroke symptoms? A. Clear speech. B. Strong bilateral grips. C. Decreased LOC. D. Warm skin. Correct answer, C. Decreased LOC. Rationale: lower consciousness may indicate increased ICP or stroke progression. Strategy: monitor LOC frequently using standardized tools. 18. A family member asks, why can't he drink water? Best response? A. We aren't allowing liquids today. B. He may choke due to swallowing issues after stroke. C. It's hospital policy. D. He's not thirsty. Correct answer, B. Rationale: dysphagia is common and poses aspiration risk. Strategy: use clear, therapeutic communication. 19. The speech therapist conducts a swallow screen. Purpose? A. Check memory. B. Evaluate risk for aspiration. C. Check eye movement. D. Evaluate facial symmetry. Correct answer, B. Rationale, swallow evaluation guides diet and safety decisions. Strategy, collaborate with an interprofessional team. 20. The patient develops drooling on one side. Interpretation? A. Normal. B. Cranial nerve impairment. C. Mild dehydration. D. Emotional response. Correct answer, B. Rationale, drooling suggests impaired swallowing or facial muscle weakness. Strategy, report new cranial nerve deficits. 21. The nurse notes right-sided neglect. Best nursing action? A. Ignore it. B. Place items on the left side. C. Place items on the right side. D. Restrain the right arm. Correct answer, C. Place items on the right side. Rationale, encourages patients to attend to the affected side. Strategy, promote awareness and rehabilitation. 22. Priority lab before TPA administration? A. Potassium. B. INR. C. Cholesterol. D. Sodium. Correct answer, B. INR. Rationale, elevated INR indicates bleeding risk and contraindicates TPA. Strategy, always assess coagulation before thrombolytics. 23. The CT shows no bleeding. What does this indicate? A. Hemorrhagic stroke. B. Ischemic stroke. C. No stroke. D. Dehydration. Correct answer, B. Rationale, absence of blood suggests ischemic stroke, eligible for TPA if within window. Strategy, use CT findings to guide treatment. 24. The nurse starts the TPA infusion. What must be monitored closely? A. Skin turgor. B. Bleeding. C. Urine color. D. Appetite. Correct answer, B. Rationale, TPA increases bleeding risk systemically. Strategy, continuous assessment for bleeding signs. 25. Which sign requires stopping TPA infusion immediately? A. Nausea. B. Mild headache. C. Sudden severe hypertension. D. Anxiety. Correct answer, C. Rationale, sharp rise in BP increases risk for intracranial bleeding. Strategy, no emergency criteria for stopping TPA. 26. After TPA, the nurse avoids A. Frequent VS. B. Neurochecks. C. Invasive procedures. D. Repositioning. Correct answer, C. Rationale, invasive procedures increase bleeding risk post-TPA. Strategy, prevent trauma and minimize needle sticks. 27. The patient begins vomiting. Concern? A. Dehydration. B. Increased ICP. C. Hunger. D. Medication reaction. Correct answer, B. Rationale, vomiting can signal increased intracranial pressure. Strategy, neurochanges equals emergency. 28. The patient's BP is 205/110 during TPA infusion. Priority? A. Stop infusion. B. Notify provider. C. Offer fluids. D. Document only. Correct answer, B. Rationale, high BP during TPA increases bleeding risk, requires provider intervention. Strategy, no BP thresholds during treatment. 29. Family asks why MRI isn't the first test. Response? A. MRI is too slow for emergencies. B. CT is faster and identifies bleeding immediately. C. MRI is dangerous. D. CT gives better pictures overall. Correct answer, B. Rationale, CT quickly identifies hemorrhage and guides urgent treatment. Strategy, explain diagnostics in simple terms. 30. Which assessment finding requires immediate intervention? A. Mild arm drift. B. GCS drop from 14 to 10. C. Facial droop. D. Slow speech. Correct answer, B. Rationale: significant decline in GCS indicates neurologic deterioration. Strategy: treat rapid neurodecline urgently. 31. What is the priority nursing action when the patient becomes lethargic? A. Let him sleep. B. Assess airway and breathing. C. Offer oral fluids. D. Apply warm blankets. Correct answer, B. Rationale: lethargy may precede loss of airway, especially in neuro patients. Strategy: ABCs always first. 32. The patient has difficulty forming words. Term: A. Dysphagia. B. Aphasia. C. Ataxia. D. Agnosia. Correct answer, B. Aphasia. Rationale: aphasia refers to impaired speech or language ability. Strategy: identify stroke-related communication deficits. 33. Which order requires clarification in acute ischemic stroke? A. NPO. B. Aspirin immediately. C. Bedside swallow test. D. Frequent neurochecks. Correct answer, B. Rationale: aspirin is held if TPA is being considered or administered. Strategy: no medication restrictions around TPA. 34. The patient becomes incontinent. What does this indicate? A. Normal response. B. Neurologic impairment. C. Lack of effort. D. Dietary issues. Correct answer, B. Rationale: sudden incontinence may occur from impaired brain control. Strategy: monitor functional changes. 35. Which vital sign is most critical to monitor during stroke? A. Temperature. B. Blood pressure. C. Respirations. D. Pulse. Correct answer, B. Rationale: BP determines cerebral perfusion and TPA eligibility. Strategy: focus on variables affecting brain oxygenation. 36. A new L-sided facial twitch appears. Concern? A. Muscle fatigue. B. Seizure activity. C. Anxiety. D. Dehydration. Correct answer, B. Rationale: focal twitches may indicate seizure onset from stroke. Strategy: report seizure signs urgently. 37. The patient reports sudden vision loss in one eye. Interpretation? A. Cataracts. B. Retinal edema. C. Stroke-related visual deficit. D. Floaters. Correct answer, C. Rationale: stroke can affect the visual cortex or optic pathways. Strategy: treat any new deficit as progression. 38. Best method to communicate with expressive aphasia? A. Speak loudly. B. Provide yes/no questions. C. End conversation. D. Repeat questions rapidly. Correct answer, B. Rationale: simplified questions help aphasic patients express needs. Strategy: use therapeutic communication. 39. The patient tries to stand without assistance. Best action? A. Encourage independence. B. Apply restraints. C. Activate bed alarm. D. Ignore behavior. Correct answer, C. Rationale: stroke patients have high fall risk. Strategy: use safety interventions, not restraints. 40. During neurocheck, the nurse finds unequal hand grasps. Interpretation? A. Stroke instability. B. Normal for age. C. Hand injury. D. Anxiety. Correct answer, A. Rationale: weakness difference indicates worsening or evolving stroke. Strategy: document and report promptly. 41. Which assessment should be done first every shift? A. Bowel sounds. B. Neurological exam. C. Skin turgor. D. Pedal pulses. Correct answer, B. Rationale: neurostatus is priority in stroke. Strategy: prioritize life and brain-saving assessments. 42. Purpose of FAST in community settings? A. Diagnose stroke. B. Screen for early signs. C. Decide medications. D. Educate on diet. Correct answer, B. Rationale: FAST identifies probable stroke for rapid EMS activation. Strategy: FAST equals quick assessment tool. 43. After TPA, the nurse sees bleeding from foresight. Action: A. Remove the 4. B. Apply pressure and notify provider. C. Ignore. D. Stop all meds. Correct answer, B. Rationale: TPA increases bleeding, pressure reduces risk of worsening. Strategy: monitor for systemic bleeding. 44. What positioning is appropriate in acute stroke? A. Flat in bed. B. 30-degree head elevation. C. Trendelenburg. D. Prone. Correct answer, B. Rationale: promotes cerebral perfusion while preventing aspiration. Strategy: proper positioning maintains oxygenation. 45. The patient reports tingling in the right arm. Interpretation: A. Hyperventilation. B. Sensory deficit. C. Allergic reaction. D. Dehydration. Correct answer, B. Rationale: sensory changes indicate stroke involvement. Strategy: trend sensory findings with motor deficits. 46. What indicates a successful response to TPA? A. Improved speech clarity. B. Increased sleepiness. C. Higher BP. D. New bleeding. Correct answer, A. Rationale: neurological improvement indicates reperfusion. Strategy: evaluate return of function. 47. Why perform frequent neurochecks after TPA? A. Detect bleeding or worsening deficits early. B. Promote rest. C. Maintain routine. D. Check for dehydration. Correct answer, A. Rationale: neurochanges may indicate intracranial hemorrhage. Strategy: scheduled neurochecks are critical. 48. Family asks, what does time mean in FAST? Response: A. Time to call a friend. B. Time to seek emergency help immediately. C. Time to take medications. D. Time to sleep. Correct answer, B. Rationale: FAST-T emphasizes activating EMS immediately. Strategy: reinforce urgency in stroke response. 49. Purpose of NIH stroke scale? A. Evaluate nutrition. B. Assess stroke severity. C. Determine BMI. D. Predict renal function. Correct answer, B. Rationale: NIHSS standardizes measurement of neurological deficits. Strategy: use scoring systems for objective assessment. 50. Final teaching before discharge, which statement shows correct understanding? A. If symptoms return, I'll wait to see if they improve. B. If he shows fast signs again, we will call emergency services immediately. C. He can take any herbal medicine he likes. D. We don't need to monitor blood pressure anymore. Correct answer, B. Rationale: fast signs require immediate emergency action to prevent disability. Strategy: reinforce recognition and rapid response to recurrence. Thank you for watching NCLEX Made Easy 91. I hope today's fast stroke case study strengthened your clinical judgment and test-taking skills. If this video helped you, don't forget to like, comment, and subscribe for more high-yield NCLEX practice. Share this video with a friend who's also preparing, and remember, success on the NCLEX comes from consistent practice. See you in the next video. Keep studying smart.